patient in her 50s, history of left breast cancer, and then she had reconstruction with Alloderm, which is cadaveric skin, and she came in with a grade 4 capsular contracture. The reconstruction was done just in 2021, so just 3 years ago. So grade 4 capsular contracture on the left side. This is the side where she had 25 cycles of radiation, Alloderm, and a lot of pain. So she came to me. She ultimately wanted the desired flat chest closure. So as you will see on the right side, you can focus in on this side. This is the white part is the Alloderm. And as I will turn this around, you will see here is the ethibond suture, which was removed along with some inflamed tissue. So alloderm right here, which is cadaveric skin, and complete removal of the entire implant capsule. Some areas relatively thin. This was just done 3 years ago. This is the right mastectomy scar. I did the right side first. This is the non-cancer side, and as you can see, some flat areas relatively thin, some areas thick, and ultimately she got the nipple areola complex with a tag at 12 o'clock to orient the specimen. She had the right side prophylactically done, meaning no history of breast cancer on the right. But this is where the alloderm was removed. So I'm going to go away from the alloderm since that is very hard. And I'm going to go ahead and you can see again, look at this ethibond suture. So anything inflamed, anything abnormal, anything foreign like this ethibond suture, alloderm, all of it is completely removed. And I go in. Blood loss was minimal. I'm going to go right through it. So very thick. Alloderm is very thick. Remember, this used to be someone else's skin, another patient's skin. And I'm actually going to go in here. The goal is to remove everything foreign. Remember, anyone can remove implants. So as I remove this, you will see an intact implant. You can see it's a little bit on the uh, non-gray side. As I remove this fluid around, you will see this is the gel bleed that occurs. And so this is your mentor implant, 685, just like the patient stated. As you can see, it's not that gray, silver gray appearance. It has like a yellow tinge to it, intact implant. And you'll see, look, as soon as I go in, you will actually see the alloderm right here. You can actually see the skin appendages, meaning the hair follicles from the other person's cadaveric skin. So all the way this was used as reconstruction, and all of the alloderm was removed, and there was lots of it that was used. These are the fenestrations that were in the alloderm, and so all of the alloderm was removed, and the capsule was removed as well. So as you will see right here, the capsule is so thin. If I put my ruler back there, you can see LLC, WWW. No matter how thin the capsule is, it needs to be completely removed along with anything foreign. And overall, I'm very happy and content. So what I'm going to do now is I'm going to change my top gloves. You can see over here what is removed is the alloderm, suture, ethibond suture, implant, capsule, and anything inflamed, so that all of this is going to be tested as well. I'm just removing my top pair of gloves. So now I'm on the left side. Similarly, you will see you have the suture to orient the 12 o'clock. Remember, this is the cancer side, the left mastectomy scar. And I'm going to send this off to pathology, as you will see, for the contouring. Relatively very thin flap. And as again, you will see, look at that extensive amount of alloderm that was used in the reconstruction on the front and in the back. And so as I go in, we will see she has the capsular contracture on this side, history of radiation. Here we go. Just done 2021. You can see how thick this is. I'm having a hard time cutting through it. That's like cutting through leather, if you will. And as I remove it, you will see some fluid around. And this is your Mentor 685 intact implant. You can see this is relatively clear right through, versus this is more opaque. You cannot see right through this. This is blurred, not clear. This one is overall clear. So if I put my finger here underneath, you can see my gloves. I don't want to touch this yet. And as you'll see, it's an extensive amount of Alloderm that was removed. And I'm very happy and content with how the whole dissection has went. So there you have it. Um, uh, 2021 left breast cancer reconstruction with Alloderm. What was removed again today was ethibond suture on the left and the right, plus the Alloderm, plus the implant, plus the capsule, and anything inflamed. And the capsules will be sent to pathology, roll out the BIA, ALCL, CD30 analysis, roll out lymphoma, roll out malignancy, roll out any abnormal pathology, cultures for aerobic, anaerobic, and fungal. Implants will be returned to the patient, and most importantly, we'll see how the patient feels post-op minus the symptoms of breast implant illness, and certainly the capsular contraction that she had on the left side. This is Dr. Khan, executive plastic surgeon. What you can do is, if you can give me best.